So here we see an MRI of a patient consulting for back pain. Obviously, that's why we had an MRI done. So this is what we call magnetic resonance imaging of the lumbar spine. You see, this is the side view of that MRI of the spine of the patient. And to orient you, the front portion is where you have your stomach. The back portion is where you have your skin, and you can actually see the bones that you can palpate at the back. So of course, the head is at the top, the hips are at the bottom. So that is just to orient you when you're looking at that MRI. You see, you have those square things, and in between those are what we call the discs. The square things are your bones, what we call the vertebral bodies. You see that there's different colors. You see some discs that are bright in signal intensity, and there are some discs that are dark in signal intensity. When you see this disc that has bright signal intensity, it means it has a lot of water content. But when you start seeing them to look a little bit darker, or they start losing their signal intensity, that means that they are starting to desiccate. They are starting to dry up, and that is what we call degeneration. This degeneration is a process, a normal process wherein all of us will undergo. It may happen as early as age 20, and the rate or how fast it happens is very individualized. So we cannot predict as doctors how fast degeneration will set in, or who will have degeneration at an earlier age or at a later age, because this is largely dictated by our genetics. So our genetics will dictate. It's like how our hair will turn white. Some would have turning white hair na even at a young age, while some patients in their advanced years, they still have a full head of dark hair. So it is largely dictated by our genetics. However, there are multiple factors that can influence degeneration. A very good study showed that when you're sitting in a certain posture, it puts a lot of disc pressure on your spine. So ideally, a patient will, if you're standing, about 100% of the weight will pass through your lower back. But when you're sitting, that increases. So the disc pressure increases. If you're bending forward, that also adds more compared if you're reclined 110 degrees. So if you will translate that to something more practical, if your work entails you to be sitting for long periods, then you should be mindful of your posture. You put a lumbar support so you're a little bit reclined, and make sure that your ears, your shoulder, and your hips are well aligned, so that when you're working, it's more of a constant load rather than a crooked back. And so with that also, it would be good to take frequent breaks. So let's say you're sitting, your work entails you to be sitting for long periods of time, set an alarm. Put like 20 minutes and then it alarms you. Just stand up, you walk around, and then sit down. Or even as you're seated down, you should do some stretching exercises, because your disc gets nutrition when you're moving. So if you're constantly in one position, the diffusion of nutrients is slower. And that would probably be the theory behind degeneration when you're sitting for long periods of time. Aside from occupation and lifestyle, we talk about vices. We have seen that smoking also will now impede the nutrition of your disc. And so with that theory in mind, then there may be advanced disc degeneration in smokers. This is not seen in alcohol, and heavy consumption of alcohol. But we have also seen that the diffusion of nutrients, because there is a problem already with the diffusion, we also see it in certain disease conditions, such as patients who are hypertensive and diabetics. So with that, we may be on the lookout for this degeneration, this subset of patients. Obesity also, patients would ask me kung mataba ako or tataba ba ako, will I get faster degeneration? Or if I lose weight, will it degenerate slower? There is no direct correlation, and it's still controversial, but currently, there is no strong evidence that obesity will cause faster degeneration. Of course, back pain, as talking about it, 80 to 90% of the adult population will experience back pain once in their life, And luckily, a vast majority of these patients would improve within 6 weeks of no matter what treatment that is done, whether they take medications, they do PT, rest, and that is a very positive note for us. However, there may be certain conditions that warrants your doctors to see you, or for you to see your doctor. There are certain red flags that would accompany back pain, wherein I would really tell a patient, you have to see a doctor. So that would include weight loss, signs of nerve impingement such as pain that goes down your legs, or numbness or weakness of certain motor movement. If you have a previous history of cancer, that is also something that that would warrant further investigation, or pain that is lasting for more than 4 weeks or a month, then you should see your doctor. Other things that you would look into would be night pains, pain that is worse at night, then you should go see your doctor as well. So it is something that I would reassure our patients and our viewers that when this is encountered, it is not an adversely serious condition. All of us will degenerate, but then sadly, some of us may present with symptoms such as back pain. Sadly, we don't have a cure yet because we cannot make patients younger. We cannot regenerate the spine, particularly that of the discs. Our shock absorbers, they get nutrition by diffusion, and they do not have their own blood vessel that will supply them with nutrition. And so we haven't really found out how we can regenerate the discs, but making sure that we have proper spine mechanics, and maybe when we're doing our activities, we're always mindful, core exercises to help our spine. Those are ways for us to help our back. But for medications in itself or supplements, sadly, we do not have very strong evidence that they will reverse degeneration.